different. We classify hematopoiesis into prenatal, before birth, and postnatal, after birth. And prenatal occurs at first in the wall of yolk sac. After this, in the liver and spleen, and by the birth in bone marrow. At first, as megaloblastic hematopoiesis in yolk sac, when the diameter of erythrocytes is more, and sometimes with nuclei, and normoblastic by the birth and after the birth in normal red blood cell of normal size. And this picture illustrates the stages of hematopoiesis. First of all, the blood stem cell gives all the formed elements. This is so-called pluripotential cell. This cell looks like small-sized lymphocyte. After this, the second class, semi-stem cell, giving the precursor cells for lymphopoiesis and precursor cells for all the other part of kind of formed elements. Semi-stem cell, two kinds of the cells. These cells are also look like small-sized lymphocyte. The class number 3 we describe as colony-forming unit. Here, colony-forming unit for monopoiesis, colony-forming unit for granulopoiesis, colony-forming unit for eosinophil, colony-forming unit for basophil, colony-forming unit for thrombocytopoiesis, and for erythropoiesis, this is burst-forming unit, and also for colony-forming unit for erythropoiesis. The cell population of classes number 1, 2, and 3 keep their population, and as well, them looks like small-sized lymphocyte. We can differentiate them using morphological method, only immunological, according to receptors of these cells. After this, class number 4. Class number 4 are blast cells, include blast cells. We can differentiate without special technique, without special skill, monoblast from meloblast, from megakaryoblast, from erythroblast, from lymphoblast, and from BOT lymphoblast. But we can differentiate the cell as blast cell. This cell is larger than small-sized lymphocyte with well-visible multiple nucleoli in nucleus. Are you with me?
Yes.
Okay. And also basophilic cytoplasm. Multiple nucleoli are typical for blast cell. This is class number 4 of hematopoiesis. And after this, differentiating or maturing cells, this is class number 5. In some of these classes, only one kind of the cell occurs, and for the others, it's more complicated. But first kind of the cell that we classify as maturing cell is so-called pro-monocyte. Pro pro-megakaryocyte, pro-megakaryocyte, pro-erythrocyte. Sometimes traditionally we can see pro-erythroblast, but it's traditional term. After this, pro-T lymphocyte, pro-B lymphocyte. Is this clear? At this stage, we can see initial stage of differentiation and appearance of some specific granules. For example, it's typical for myelopoiesis. Nuclear shape of nuclei is still round. And after this, sometimes this is the only kind of the cell within differentiation. Only one kind of the cell at this stage. For T and B lymphopoiesis, also only one stage in class number 5. You see? After this, for thrombocytopoiesis, pro-megakaryocyte and megakaryocyte, because megakaryocyte, this is giant cell, and this cell can't leave bone marrow. And platelets are fragments of cytoplasm of megakaryocyte. That's why here it's also easy to remember pro-megakaryocyte and megakaryocyte that we describe as different phases of differentiation in thrombocytopoiesis, and only two kinds of the cell in class number 5. More complicated is myelopoiesis. Myelopoiesis is differentiation of precursor cell into neutrophil, eosinophil, and basophil granulocytes. What kind of events we can see here? First of all, pro-site, pro-myelocyte for neutrophil, pro-myelocyte for eosinophil, pro-myelocyte for basophil. After this, myelocyte, you see increasing of specific granules in cytoplasm, but the nuclei stay or are still round in shape. In fact, the ability to divide possible only if round of nucleus is spheroid, and this is the latest stage when the cell can be can divide. The next stage is metamyelocyte. You see the large amount of specific granule in cytoplasm, and the shape of the cell isn't spheroid anymore. And metamyelocyte and band cells. In fact, band neutrophil we can see also in peripheral blood smear. Is this clear?
Yes.
And metamyelocyte is post-mitotic stage of differentiation without ability to divide. About another unusual lineage, this is erythropoiesis. We see number 5. Remember, pro-erythrocyte. After this cell differentiate to to storage hemoglobin, to prepare hemoglobin for transport of oxygen and carbon dioxide. That's why the first aim of this differentiated cell is to use polysomes in synthesis of chains of hemoglobin. That's why after proerythrocyte, the next kind of the cell is basophilic proerythrocyte. Basophilic, why? Because this cell increase the amount of polysomes in cytoplasm, and polysomes gives basophilia of cytoplasm. After this, the ribosomes produce start synthesis of chain of hemoglobin. That's why hemoglobin is oxyphilic. Polysomes basophilic. Oxyphilic plus basophilic is mixed, polychromatophilic. And you see the compactization of nucleus. And polychromatophilic is the final stage of the cell with ability to divide. And finally, when all the hemoglobin is produced, we can see oxyphilic proerythrocyte. You see, procyte, according to our rule, after this increase amount of ribosomes in cytoplasm, basophilic. After this, ribosomes plus polypeptides of chain of hemoglobin is polychromatophilic, and after this, when hemoglobin is predominant, this is oxyphilic. And at the end of this stage, we can see enucleation, extrusion of this nucleus out of the cell. And you know what is it, class number 6, because in class number 6, we can see mature cells or all the formed elements that we can reveal in peripheral blood smear. Is this clear?
Professor, I have a question about megakaryocyte. Because it can leave the bone marrow, so it sends pieces of the cytoplasm. Is that piece still active, like they can do the function or not?
What do you mean?
The thrombocyte.
Thrombocyte is a fragment of cytoplasm of megakaryocyte. In bone marrow, megakaryocyte is located close to sinusoid, releasing the fragments of it as platelets into bloodstream. And after releasing the thrombocytes or platelets, it's the same, start working.
Okay, thank you.
You're welcome. You're welcome. And in peripheral blood, we can see also lymphocyte without differentiation of them with morphological method. Here, the same similar picture, pluripotential stem cell, multipotential stem cell, myeloid cell line, lymphoid cell line. After this, colony forming unit for different kind, and after this, blast. After this, maturing or differentiating cells. And finally, this is mature cells or the formed element that we can see in blood smear of peripheral blood. In this picture, we can see part of lineage of differentiation. Here you see pro-erythrocyte, basophilic, polychromatophilic, oxyphilic. Procyte, what is this class? What is this class, procyte? Class number
5.
Number 5, very good. And reticulocyte and erythrocyte, class number?
Number 6.
Yes. And here, this is features of degeneration of nucleus before enucleation. This is post-mitotic stage of differentiation in erythropoiesis. This is a view of erythroblastic islets. I'll demonstrate another picture in next slides. Here, megakaryoblast. What is this class?
That's number 4.
Class number 4. Pro-megakaryocyte, megakaryocyte. What are these class?
Number 5.
Number 5. And platelets, number 6.
Number 6.
Yes. What is it? PM? Post-mitotic, without ability to divide. Okay. Here the same, meloblast. Meloblast, what is this class? Class number? I'm listening.
Class
Blast. Number 4. Promyelocyte, myelocyte, metamyelocyte. This is
5.
class number 5. Band cell we can see also in peripheral blood. That's why band and neutrophil we describe as class number 6. What is it? PM? Post-mitotic. I hope that is clear to you. Yes, this is the same or similar. After this, here, monoblast. What is this class?
Number 4.
Number 4. Procyte, promonocyte. Number 5. And monocyte?
Number 6.
Yes. Okay. About the T and B differentiation. It's some features in the differentiation, and in fact, the first kind of differentiation occurs in central organs of immune system, in bone marrow and in thymus. And here, the result of differentiation is appearance in thymus T helper and T cytotoxic cell, and the result of differentiation of precursor cells for B lymphopoiesis in bone marrow is formation of B cell. And first of all, the education of this cell in central nervous system, the aim of this education is not to attack its self-antigen, recognize and not to attack it. After central organs of immune system educated but naive or virgin T and B lymphocyte after central organ, T after thymus and B after bone marrow, leave this organ and migrate to peripheral lymphoid organ for immune response. This is one more scheme of the same. And In fact, I explain everything. You see, traditional pro-erythroblast, basophilic erythroblast, and so on, but it isn't very important differences. This picture demonstrates the stem cell and some function of stem cell. For erythropoiesis, features of erythropoiesis, cytoplasm becomes progressively less basophilic because of dilution of ribosome. Nucleus size decreases, cell size decreases, cytoplasm becomes more and more basophilic. I explained everything. We can see this description again after my explanation. Here is a photo, and this is drawing of the same process. About granular cytopiesis, I'm sorry, could you switch off your microphone if you are not going to ask me something, because I can hear noise. Noise and singing is on also. Organs of immune system. It's very important. It's very important slide describing the principal differences between central organ of immune system and peripheral organs of immune system. First of all, central organs of immune system include bone marrow and thymus, and peripheral, spleen, lymph nodes, tonsils, and as well mucus-associated lymphoid tissue, MALT, including gut-associated lymphoid tissue along the gastrointestinal tract, BALT along the broncho-associated lymphoid tissue along the You are disturbing me. Switch off your microphone. Malt and salt. Salt means skin-associated lymphoid tissue situated in skin. And here, in here, central organs of immune system. In central organs of immune system, antigen-independent differentiation and proliferation takes place. It means without meeting with foreign antigens. Main aim of it is to recognize and not to attack itself antigens. For peripheral organs of immune system, including spleen, lymph nodes, tonsils, mucus-associated lymphoid tissue, and skin-associated lymphoid tissue, is the place for immune response after meeting with foreign antigen. Let's describe all of them. First of all All the organ of immune system except thymus originate from mesenchyme. Embryonic origin of thymus is epithelium of pharyngeal arches. Are you with me? That's why stroma of all organs of immune system except stroma of thymus represent reticular tissue. Stroma of thymus is formed by epithelio-reticular tissue. Epithelio-reticular tissue. Bone marrow. Bone marrow is situated in spongeous part of bone in the cells, and there are different places for taking it out. Here, for example, aleocicili and sternum. Bone marrow is fluid, in fact, organ, not. That's why it's possible to make bone marrow smear. Like any organ, bone marrow consists of different components. Let's describe them together. Number one, stromal component. Number two, hematopoietic component or compartment. Number three, vascular compartment. Stromal compartment include macrophages, adventitial cells, adipocytes, reticular tissue, and cells of endostome. Hematopoietic compartment include all the compartments that we described in hematopoiesis: erythroid, myeloid, lymphoid. And finally, the vascular. Vascular compartment represent blood vessels. Blood vessels are situated not together, but it's independent direction of them. Muscular type of artery and vein, and two kinds of capillaries: continuous to supply with oxygen and sinusoidal for specific functions. Can you hear me?
Yes, we can hear.
Oh, okay.
Yes.
Okay. Here is the cross section of bone, and you see decalcified bone here, and the location of red bone marrow in here. This is red bone marrow or medulla osseum rubra, and yellow bone marrow. In most of it is replaced by adipose tissue, but after severe bleeding, yellow bone marrow is transformed into back to red bone marrow. What is this tissue? This is bone tissue. What is this compartment? Hematopoietic. And this part, stromal compartment of adipose. This picture, I took it from Ross, illustrates the fine structure of bone marrow in the body. First of all, we can see different compartments. Yes, here, hematopoietic compartment, including giant cells megakaryocytes in it. After this, stromal compartment, including adventitial cell, adipose cell, cells of endostome, and macrophages, and two kinds of capillary: arterial capillary to supply with oxygen, and sinusoidal capillary for specific function. And I told you before that megakaryocyte we can see close to the lumen of sinusoid, releasing the fragment of them as platelets. This picture illustrates interrelations between arteriole and venule, and pay your attention, the diameter of arteriole is more than diameter of efferent venule. That's why, as a result of higher blood pressure, the lumen of venule is always open. And here we can see the third kind of capillary, sinusoidal, with wide diameter, and this is fragment of megakaryocyte that becoming the platelets. This endothelial cell, reticular cell, reticular fibers as stromal component. Is this clear?
Yes.
Okay. Let's find all the features typical for bone marrow in section. This is bone. In here, we can see giant cells. What are these? Megakaryocytes. Yes. Here, the space is filled with erythrocytes and wide in diameter. This is sinusoids. Yes. And sometimes we can see components of stromal components. I told you before that we can see two kinds of slides with bone marrow. The first is a section, the second is smear. If compare this with it, I try to give you the same erythrocytes in diameter, you see, the same. But what's the difference? First of all, predominant cells in blood smear are erythrocytes. Predominant cell in bone marrow is nucleated cells. Understand me? Different in size, in degree of differentiation, and so on. And that's why, because of lots of nucleated cells in it, bone marrow in hematoxylinazine stain looks intensive basophilic. Okay, and this picture demonstrates endothelial cell of sinusoid, also sinusoid, and this is endothelial cell. This endothelial cell of first type of capillary to supply this organ with oxygen, and this hemopoietic compartment, this adipose tissue, that's why it's component of stromal compartment. Is this clear?
Yes.
The same. Here is bone. This is the cartilage here. And this is megakaryocyte.
Professor, we cannot hear you.
Yeah, there isn't sound. God. Professor, we can't hear you. Okay, she can't hear us too.
Can you hear me now?
Yes, now.
Yes.
Yes.
Mhm. Thank you that you informed me about it. Here you see the differences between the education in central organ and immune response in peripheral. In central organ, it's necessary not to attack its self-antigen, but in peripheral organs, this immune response against either absolutely foreign antigens or against infected itself cells or malignant cells. Also, it leads to immune response. I decided also to remind you the view of small-sized lymphocyte. This is round and dense chromatin in nucleus. Nucleus is round, chromatin is dense, and hemiluna of cytoplasm because of multiple polysomes in cytoplasm of this cell. In fact, this is the view of cells of classes number 1, 2, and 3. Stem cell, hemistem cell, and colony-forming unit. The thymus. The features of thymus: incomplete lobule, dividing into cortex with blood thymus berry in it, and medulla with Hassel's corpuscle in it. The stroma is unusual. Stroma, because of origin from epithelium, it's epithelial reticular cell, and the lobulated structure, but lobules are incomplete. This is the same. This is location of primordium of thymus here in pharyngeal arches, pharyngeal pouches here, and yellow are parathyroid, superior and inferior. Inferior migrate downward, superior migrate upward. This picture illustrates all the process of lymphopoiesis situated either in bone marrow or in thymus. First of all, in bone marrow, this is class number 1, class number 2. In thymus, class number 3, or colony-forming unit for T lymphopoiesis, migrate in thymus, and after this, in thymus, the differentiation of T cell and selection of T cells occurs in thymus. TCR means receptor, T cell receptor. CD, this is cell differentiation receptor. And during the, you see, in thymus, class number 3, number 4, number 5, and even number 6. And after this, here, CD4 are T helper cell, naive or virgin. CD8, this is T cytotoxic cell, migrating in blood and later in peripheral immune organ or peripheral lymphoid organ. Is this clear?
Yes.
Yes, Professor.
Okay. Thymus, parenchyme. Parenchyme or this is stroma and parenchyme, epithelial reticular cells, epithelial cell, and thymocytes are differentiated cells of T cells from precursor cells. About the selection, in thymus, at first, this is doubled negative T cell, precursor cell entering by the thymus from bone marrow, leg surface molecule typical of mature T cell. After this, the next stage is so-called double positive T cell. On the cell, T cell receptor appears here, but as well on precursor cell, we can see both both receptors of cell differentiation or cluster, C, not cell, but cluster differentiation. CD4, finally, this is single positive C cell as a result of selection, and you see in this cell only T cell receptor and CD, cluster differentiation 4, and on it T cell receptor and cluster differentiation 8. Altogether, it's typical for cytotoxic. And T cell lose expression of either CD4 or CD8 and increase the level of expression of T cell receptor during the selection and differentiation in thymus. This is a scheme of the structure of thymus and different kind of epithelial reticular cell. First of all, the capsule, and we can see the first type epithelial reticular cell. And this is here type 4 and type 3 of epithelial reticular cell. All these compartments are thymus with very strong barrier, preventing the entering of foreign antigen during education of this cell. First of all, here we can see appearance of T cell receptor, and after this, the education. If not pass, if it attack itself antigen, such student, because it's education and differentiated lymphocytes, we can describe as students there. Students eliminates here by macrophages and undergoes apoptosis and phagocytosis by macrophages. And after the education, only from 1% to 5% of these so-called students get diploma and becomes educated T lymphocytes. After this cell migrate transported into medulla, and in medulla we can see different type of epithelial reticular cells. You see, this is number 5. And number 6, we are interested in number 6 because this is epithelial cell, and the result of keratinization we can see as very bright marker of thymus. Under microscopic examination, Hassel's corpuscle. Hassel's corpuscle. After selection and education, T cells enter bloodstream. It's necessary to know that blood-thymus barrier is situated in cortex, and components of it include endothelium, first type of endothelium, this continuous endothelium. After this, basement membrane, continuous basement membrane. After this, loose connective tissue with macrophages in it. After this, remember, basement membrane of epithelial reticular cell, because epithelial reticular is epithelial cell, and for epithelial cell, presence of basement membrane is necessary component. And this is epithelial reticular cell with tight junctions between them. This is very strong barrier to prevent entering of foreign antigen in central organ of immune system. Is this clear?
Yes.
This is thymocytes differentiating T cells from at different stages of differentiation. This picture illustrate the same, but I think more clearly. First of all, this is endothelial cell, this basement membrane, continuous basement membrane. If summarized, this is first type of capillary. After this, the cell that enclosed by basal lamina is pericyte. After this, the space with macrophages in it. After this, basement membrane of epithelial reticular cells and reticular cells with tight junction. And this is timocytes, cells of lineage of T lymphopoiesis at different stage of differentiation. Here the same. This is the features of blood supply and venous outflow from thymus in here. And how to differentiate in slide. First of all, remember I told you lobulated. This is lobules and very well visible dark periphery cortex, more pale medulla. Barrier in cortex, in medulla, Hassel's corpuscle. Hassel's corpuscle are kind of a type of differentiated and differentiated epithelial reticular cells, type 6, with keratinization. This is amorphous part keratinization. At the periphery, this is epithelial reticular cells that undergoes degeneration. Here, thymic corpuscle or Hassel's corpuscle, electron micrograph, and this is microscopic, light microscopic. Is this clear or not? In medulla.
Yes.
About peripheral. Peripheral organs provide antigen-dependent proliferation and differentiation or immune response. There are two kinds of immunity: cellular immunity by T cell plus antigen presenting cell, and humoral immunity B cells plus antigen plus T lymphocyte. Major cell participating in immune response and reaction B lymphocyte, bone marrow derived, differentiate in bone marrow. T cell, bone marrow derived, differentiate in thymus. And the result of this differentiation is helper T cell and cytolytic or cytotoxic T cell. Accessory cell or antigen presenting cells include macrophages, monocyte-derived dendritic, monocyte-derived and follicular dendritic cells, a lymph node-derived cell. And the immunocompetent cells we can see in this picture, B, T, and antigen presenting. Remember, I told you about the passport of the country. MHC1 possess all the cells or in organism, nucleated cells, first of all, and platelets. But as well, this is additional receptor, MHC2. MHC2 like document that this is secret service in this country, not only passport, but also some rights to check, to arrest, and so on. This is immunocompetent cells, including B, T, and antigen-presenting cells. Now we describe this kind of immune response or immune reaction. This picture illustrates typical interrelations with antigen and CD8 cell. CD8, this is cytotoxic cell, and cytotoxic destroy cancer specific malignant cell. Here. This scheme illustrates interrelations of antigen with helper cell, CD4 positive T cell. This is presentation of foreign antigen by macrophages to T helper cell. This scheme illustrate this type of immune response by differentiation of B lymphocyte. You see, CD4 after meeting with after presentation of foreign antigen to it, activate, release the interleukins, different interleukins, including interleukins that activate the differentiation of B cell, and final stage of differentiation of B cell is plasma cell formation. Main function of plasma cell is to produce antibodies. And as a result of it, there are two kinds of the cell. After the first meeting with foreign antigen, this is differentiation of B lymphocyte into plasma cell and memory B cells. Here we can see the same and brief description. Take photo if it's necessary, and I'll continue. Here, this is natural killer cell. Natural killer cell is neither T nor B, but also immunocompetent cell. And you can see natural killer cell and interrelations and destruction by this cell, malignant cell of the body. You see, this is tumor antigen on the surface of it, and this cell release fragmentin and destroying malignant cell of the body. This picture illustrates the macrophage activation by helper T helper cell, and he activated macrophages, and you see the antigens major histocompatibility complex 2, typical for TB and macrophages. And this picture illustrates the lysis of infected cell. Here we can see infected cell of lining of intestine, and this is at first this infected antigen are phagocytosed by macrophages. After this, macrophage present this antigen to the T helper cell CD4 positive. In turn, T helper cell stimulate the activity of CD8 positive or cytotoxic and or cytolytic, and this is proliferation and differentiation of it against this antigen. And finally, this is virus-infected cells undergoes lysis, apoptosis, and phagocytosis. Here, infected cell itself antigen, and this is foreign antigen of virus, for example. The description of it is here. Take photo if it's necessary, and we'll continue. This picture illustrates briefly all the components of immune reaction. First of all, cell immune response by differentiated T lymphocyte and humoral response by B cells. Here, antigen presenting cell present their foreign or malignant abnormal antigens to T helper cell. After this cell start differentiation and proliferation and activate the differentiation and proliferation of B lymphocyte and differentiation of B lymphocytes into plasma cells that produce lots of antibodies, and as well memory cell. After this, in turn, T helper cell activate the differentiation and proliferation of T cytolytic or cytotoxic, and the result of it is lots of CD8 positive cytotoxic to destroy, to kill virus-infected cell by lytic factor, and memory cytotoxic T lymphocyte. This picture is a gift from Lyudmila Alexeyevna Knyazeva to me. I asked her to use it in my presentation, and you see this picture. In the center of this picture is antigen presenting cell. This is antigen and P presentation, and here T helper cells. T helper cells stimulate B blast transformation when B lymphocyte becomes B lymphoblast, with typical view of lymphoblast with multiple nucleoli. And after this becoming differentiating into plasma cells that produce antibodies with all the typical features typical for plasma cell. This is round nucleus. The distribution of heterochromatin is like wheels of bicycle, and this very pale area, hematoxylin negative area in front of this of the nucleus. This is location of Golgi complexes and basophilic cytoplasm, because antibodies are produced on ribosomes of rough endoplasmic reticulum. And the result of this immune response is appearance of multiple plasmacyte and B memory cells. In turn, parallel to it, the T helper cells stimulate the cellular immunity, stimulate the blast transformation from T cytotoxic, educated but naive, into T blast cell, and it leads to differentiation and proliferation, and the result of this differentiation is multiple T cytotoxic CD8 positive T lymphocytes, and T memory cells. Is this clear or not? It's very good
Yes.
and very clear scheme illustrating the interrelations between cellular immunity and humoral immunity. In fact, the central cell regulating humoral and cellular immunity is T helper cell. Here is the explanation of abbreviation in this scheme. This diagram illustrates the differences in concentration of antibody as a result of the first exposure and the second exposure. This faster because of memory cells. Remember, memory cells that can lifespan of this memory cell are from months to years. Peripheral organs of immune system. Peripheral organs of immune system, spleen, lymph node, tonsils, also salt and mold. Salt, skin-associated lymphoid tissue, mold, mucus-associated, including GOLD, gut-associated, and BOLD, broncho-associated lymphoid tissue. Spleen. Spleen provides immune defense against antigen in blood. Production site of activated lymphocyte delivered to the blood, and this is important blood filter. Main function is filter of blood and as well immune response, because this is peripheral organ of immune system. And also this is site of destruction of H erythrocytes. We divide this organ into white pulp and red pulp. White pulp is lymphoid tissue. That's why term white is term of anatomists. When they cut spleen, we can see something whitish and something reddish. But after the staining by histologist, white pulp becomes intensive basophilic, and red pulp includes splenic cords. This is reticular tissue and splenic sinuses, sinusoids. This picture demonstrates the components of white pulp. This is remember that for each of peripheral organs of immune system, you must know so-called B zone and T zone. B zone in white pulp are lymphoid nodules, and T zone, this is central artery arteriole or periarterial lymphoid sheath, pulse, periarterial lymphoid sheath. Stroma, reticular fibers, reticular cells, giving the splenic cords, and in red pulp also splenic sinuses with open circulation. Open means into stroma, and closed circulation into splenic sinuses. This is low magnification. We can see lots of round lymphatic nodules along or on all the section of spleen. White pulp with splenic nodules in it. What else is important? The spleen is covered with serosa. Serosa means mesothelium plus sublime loose connective tissue, and also very thick capsule and trabecules, rich in smooth muscle cells in it. After this, intratrabecular veins are muscular without media in it. And what else we can see? Unusual view of lymphatic nodule. In lymphatic nodule or lymphoid nodule of spleen, we can see central artery located at the periphery of each nodule in spleen. This picture summarizes all the features that we can recognize in class, in practical class: mesothelium, capsule, nodule in white pulp. After this, stroma by reticular fibers and reticular cells, white pulp consisting on splenic nodules and periarterial sheath. Nodule are B-zone. T cells are situated in T-zone or pulse. Here, B-zone, and this is T-zone around the central artery. About open and closed circulation of the spleen. Number one, trabecular artery enters spleen through connective tissue trabecule. Number two, when trabecular artery leaves trabecule, becomes invested within white pulp by pulse periarterial lymphoid sheath. Trabecular artery at this level we describe as central artery. In fact, this is arteriole, but central artery is traditional term. After this, I'll demonstrate this circulation in next slide. First of all, here, look, about open and closed circulation. You see trabecular artery, after this central artery, after this penicellular arteries, and this is ellipsoidal arteries, and this open just into splenic cords, just into reticular tissue of stroma, into stroma. This is open circulation. Closed circulation, very ordinary, within blood vessels. Here, one more picture illustrating the features of open and closed circulation: trabecular artery, central artery, penicellular artery, ellipsoidal artery with sheath by macrophages, just into stroma, into splenic cords by reticular cells. But here you see the arrow from stroma to sinusoids from outside of it. This is open circulation to destroy the injured erythrocytes or old erythrocytes. After this, trabecular vein, and splenic vein, portal hepatic vein. If summarize, closed circulation: splenicolenal artery, segmental artery, trabecular artery, pulpar artery, central artery, penicillary artery, ellipsoidal arteriole, arterial capillary. After regulation within the lumen of blood vessels. In fact, this is ordinary or routine. Splenic, segmental, trabecular, pulpar, central, penicillary. After this, ellipsoidal arterial capillaries, and after this, venous sinusoid. After this, trabecular vein, segmental vein, splenic vein. After this, portal hepatic vein. This is closed circulation to supply with blood. Specific function. Remember, this is filter of blood and destroyed of injured erythrocytes or altered erythrocytes, fragile erythrocyte. Consequence for splenic, for open circulation, and you must know open and closed circulation by your colloquium and final exam. Splenic, segmental, trabecular, pulpar, central, penicillar, ellipsoidal, arterial capillary. At first the same, but here into splenic cords of the red pulp. It's important. After this, from splenic cord, return back to venous sinusoids, trabecular, segmental, splenic. Is this clear?
Yes, it is clear.
Okay. This picture illustrates the same. This closed circulation within the sinusoids. Open from the lumen into stroma, and from stroma back to the lumen of sinusoid. Fragile erythrocytes can't enter these reticular fibers and undergoes phagocytosis by macrophages. Here the same sinusoids, reticular cell, macrophages, and neutrophils here. About the clinical correlations in sickle cell anemia in spleen, it's hemolysis by macrophages in spleen. This is hereditary disease. Hereditary disease. That's why here retrograde obstruction by irreversibly sickled cell in consequence of reduction of blood flow that aggravates the obstruction because of oxygen tension decreases. After this, here preferential adhesion to sickle cell to endothelial cell increases with peripheral resistance, causes narrowing of vascular lumen. After this, dense trapping of sickle cell in splenic sinusoids and hemolysis caused by precipitation of hemoglobin and dissociation of red cell plasma membrane from sub-adjacent sub-ancient cytoskeleton, and macrophages phagocytose remnant of hemolytic sickle cells. The structure of lymph nodes. Structure of lymph nodes, first of all, this is a scheme of the structure. Immune competent towards lymph-borne antigen, lymph node, and filter of lymph. I said to you, stroma, reticular fibers, and the structure into cortex and medulla. outer cortex, this is B zone, and inner cortex, T zone, with high endothelial venule for recirculation of T cells back to bloodstream, and medulla into medullary cords and medullary sinuses. Medullary cords, this is B zone. We can see B cell, rich in B cell and plasma cell, and in medullary sinus are lined with endothelial cell with macrophages in it. This is filtration function, filtration of microorganism. This is immune response and activation, proliferation by T lymphocyte. Here is the scheme of cortex and medulla of lymph node. In cortex, we can see nodule, and between capsule and top of nodule, this pale space lining with endothelial cell and flattened reticular cell from this for lymph flows along the lymphatic sinuses. After this, subcapsular lymphatic sinuses continue with intermediate cortical, after this intermediate medullary here, and collect into central sinuses, and after this to efferent lymph vessel. Here we can see the same. You see this view of lymphatic ways from afferent lymphatic vessel along the subcapsula, along the cortical lymphatic sinus, along the intermediate medullary sinus, to the central sinus, and to the efferent lymphatic vessel. Here, low magnification, round nodule at the periphery, pale space of sinuses lining with endothelial and reticular cells. This picture I demonstrated to you several times. It illustrates the same lymph flow from afferent through lymphatic sinuses spaces to the central sinus and to efferent lymph vessel. This picture illustrates the same with more detail. If it's possible, please take photo of it. And in deep cortex, so-called deep cortex, the high endothelial venule are located. This is absolutely unusual with homing receptor. This is a place of recirculation of T lymphocytes into blood stream. B zone, lymphatic nodule in cortex, medullary cords in medulla. Medullary cords in medulla. This medullary sinus is lining with endothelial and reticular cells. This picture demonstrates also a deep cortex. Deep cortex is T zone and high endothelial venule. This picture illustrates interrelations of lymph flow with and flow into and from blood and into and from lymph. About tonsils. Tonsils are located as the first barrier between environment and nasopharynx and oropharynx. In our histology course, this is the structure of palatine tonsil. For palatine tonsil is typical lots of lymphatic nodules. Also, crypts, palatine tonsils are located between oral cavity and oropharynx. That's why epithelium covering the tonsil is stratified, squamous, non-keratinized. For tonsil is typical very deep crypt invagination, very narrow. And the crypt is lined with stratified squamous non-keratinized epithelium, typical for lining of oral cavity and oropharynx. And this is low magnification, this high magnification. For palatine tonsil is typical, number one, lining by stratified squamous non-keratinized epithelium. After this, boundary with submucosa, and here in submucosa, if we can see it, sometimes we can see the mucous glandular epithelium, and under submucosa, skeletal muscles, but not in this photo. For this, we can see, first of all, lots of lymphatic nodules and the very deep crypt lining with stratified squamous non-keratinized epithelium. This is typical view of palatine tonsil. About mucus-associated lymphoid tissue. Mucus-associated we can see, we can describe as GALT, and this is final part of small intestine before the large intestine, but this is rich in lymphatic nodules here. And this is so-called Peyer's patches. It's a typical feature of ileum in small intestine. Example of GALT-associated lymphoid tissue. Appendix. Appendix is the process of cecum rich in lymphatic nodules in the wall. And we'll return back to the structure of it a bit later with gastrointestinal tract structure. This is also kind of GALT-associated lymphoid tissue. As well, the mesothelium is covered, appendix is covered with mesothelium, and with the simple columnar epithelium lining the appendix with rare crease in it, with continuous inner and outer layer. This slide summarizes all the features typical for lymphatic nodules in bowel, GALT, and MALT, the features of lymph node, thymus, and spleen. Remember that thymus is central organ, but spleen, lymph node, and gall and mucus associated are peripheral organ. Thymus to educate T lymphocyte, and all the other organs in this slide for immune response. We described everything in organs of immune system, and finally my favorite gift from Lyudmila Alexeyevna Knyazeva. This is the picture illustrating cellular immunity formation and humoral immunity formation through the antigen-presenting cell and activating by T helper cell. T helper cell activate both humoral immunity and T cell cellular immunity. In addition, it isn't to remember by heart, of course, but it's interesting for understanding of function of immune system. This is the differences between major histocompatibility complex 1, typical for any cells of the body and for most cells of the body, and major histocompatibility C2, typical for only immunocompetent cells. This is schematic diagram demonstrating the structure of T cell receptor. And most common cluster differentiation markers used in clinical practice. We are interested in CD4, typical for T helper cells, CD8 for cytotoxic, CD60A for natural killer cell. And after this, for B cells, some of them for B cell, and so on. And in here, finally, this is the structure of antibody molecule. This is Fc fragment and Fab fragment of it. And main characteristic of human immunoglobulins. For example, immunoglobulin G is the result of secondary immune response after the first meeting with foreign antigen. Immunoglobulin M, this is principle produced during primary immune response. Immunoglobulin A, this is secretory immunoglobulin, protection against proliferation microorganism in fluid and lining. After this, immunoglobulin E, main immunoglobulin stimulating allergic reaction, stimulate mast cell to release histamine and so on, and responsible for anaphylactic reaction. And immunoglobulin D acts as antigen receptor on surface of mature B lymphocytes. Not very important. The most important immunoglobulin G, M, A, and E. Thank you very much for your attention. And write your name in Russian, correct number of your group in our chat only once, and according to writing of your names in our AOS system. Thank you for your attention. Goodbye.
Thank you. Goodbye.
Goodbye.